This podcast is sponsored by Packs. Whether on water, on land or in the air, Packs bags are both versatile and flexible backpacks that are perfectly suitable for your requirements in the most demanding of environments. Packs bags are highly regarded due to their exceptional performance in pre-hospital and in critical care environments. Renowned for their durability, they endure harsh conditions while providing rapid and reliable access to essential kit. So their well-organised compartments and customisable configurations enhance efficiency in high-stress situations. Packs bags are designed with infection control in mind and are easy to clean and disinfect. Their highly visible colours and reflective strips add quick identification and adherence to quality standards assuring reliability. The versatility of Packs bags caters to a diverse EMS providers, but also delivers vital equipment and durability and ease of use for pre-hospital critical care services globally. I've used Packs bags in a number of critical care situations and they're absolutely excellent. Please see the show notes for further details.
You're listening to the Pre-Hospital Care podcast on the Medics Academy Network.
Welcome back to the podcast. In this episode, we're going to be speaking with Jonathan Hunt-Glassman around the surge in alcoholism during the pandemic, but also tackling alcoholism and beyond. So within the pandemic, there was an exponential rise in alcohol consumption and indeed alcohol use and indeed abuse. And in this podcast, we're really going to dig into the rise of digital health innovations to treat addiction within alcoholism and indeed the critical role of medication in supporting recovery. So alcohol misuse costs the NHS in the UK approximately £3.5 billion annually, covering hospital admissions, treatments and A&E visits related to alcohol-related use. So over 1.1 million hospital admissions each year are linked with alcohol consumption, placing a significant strain on emergency services. So alcohol-related liver disease is a major cause of death, with the NHS spending heavily on treatment. And if that wasn't enough, mental health services also bear the cost of treating co-occurring conditions. So indirect costs such as productivity losses are estimated at over $7 billion annually. Public health campaigns and social care services further add to the financial burden on the NHS and wider society. So to tackle this subject, we have Jonathan Hunt-Glassman with us. Jonathan is a leading advocate for innovative approaches to treat alcohol use disorder, but also using the medication-assisted treatments and indeed the concept of moderation as a legitimate recovery goal. So he's the Chief Executive Officer and co-founder of All Health, and his personal journey and professional insights offer a different perspective on managing alcohol misuse and indeed exploring paths beyond traditional sobriety. Welcome to the podcast, Jonathan.
Thanks so much for having me.
It's great to have you with us. I wonder if we could just kick off actually and just clarify and define just the difference between alcoholism and alcohol use disorder, and indeed alcohol misuse. What's important to understand between these distinctions?
Well, alcohol use disorder is the modern medical terminology for a condition in which one has an impaired ability to stop or control alcohol use despite adverse health, social, and/or professional consequences. So alcohol is causing problems, but we're struggling to adapt our drinking in response. It encompasses a lot of terms that people have probably heard. First and foremost, alcoholism, which is kind of a colloquial term that doesn't really have a modern medical definition. And then you also brought up alcohol misuse, which is a little bit broader than alcohol use disorder. It's a term for drinking in a manner that may cause harm, but may not rise to the level of the pattern that's associated with alcohol use disorder. So something like drunk driving or a binge drinking episode, definitely alcohol misuse. We would wait to diagnose alcohol use disorder based on a persistent pattern.
So alcohol use disorder seems to be, like you said, one end of the spectrum, and then just the alcohol misuse is maybe on the way to that that end, the end of that spectrum, but not necessarily there. But could you maybe speak to your personal journey with medication-assisted treatments for alcohol use disorder? What indeed prompted you to explore this facet?
Sure. Well, I have a history with AUD and alcohol misuse that goes back to my very first days drinking. What started as binge drinking in high school and college became a pattern of drinking to blackout. And then in my late 20s and early 30s, as I saw peers start to put that sort of excessive alcohol use behind them, the opposite was happening for me. I was having multi-day binges and starting to experience the physical and mental health symptoms of withdrawal from alcohol on the back end of those. So things were pretty rough, and it was no secret to me that I had a drinking problem. So I sought help in a lot of the places that first come to mind: AA, psychotherapy, the emergency room, each helpful in their own ways, but none of which put a big dent in how much I was drinking or how much harm it was causing. What was much more of a turning point for me was connecting with a primary care physician, or a GP, as you might call them, who did two things that felt brand new. One was accept my goal of moderation rather than abstinence. And the second was suggest prescription medication as a tool in the toolkit to achieve that goal. And I was thrilled with the results I was able to achieve. I felt like I was able to get control back over alcohol. But it didn't take too much reflection to realize that 15 years of searching for the right tools for me was too long. And it didn't take too much research to confirm that I was far from alone in not having access to safe, effective medication. And those reflections were the starting point for founding More Health.
Absolutely. Could I get you to speak to moderation? Because as you said, there's multiple tools in the toolbox, and not every tool will work for everyone. Some people, like you said, advocate Alcoholics Anonymous and the 12-step process and preach it and live by it. But like you said, it doesn't necessarily work for everybody. Equally, moderation may work for others, and indeed, compared to complete sobriety. Could you maybe speak to moderation as a legitimate goal for recovery, and how valuable approach it can be for certain individuals?
In my view, moderation and sobriety are both legitimate goals. The safest level of alcohol consumption for any one of us is probably zero. So please don't take this as an anti-sobriety message. However, the harms of alcohol tend to be fairly linear with the amount consumed. So if someone can substantially reduce how much they're drinking, ideally get within national guidelines for healthy drinking, that is likely to yield significant benefits in terms of health and well-being. Um, and so I try to avoid an absolute insistence on sobriety or moderation, uh, thinking that that is likely to be a barrier to people seeking or sticking with treatment, which can be self-defeating. Whether your goal is to get as many people sober, as many people moderating, or all of the above, which would be the camp I fall into.
Yeah, no, indeed, absolutely. And like you said, it's really prudent to understand that there is different modalities which can actually lead to the same endpoint depending on the person's personality and their approach to drinking. Could I get you to speak to mindful drinking? So what mindful drinking is and how it can play a role in managing alcohol use disorder or indeed reducing alcohol misuse?
I like to think of mindful drinking as drinking with intention. And I'm borrowing that definition from my friend Derek Brown, who's an advocate for this approach, in addition to being an award-winning bartender, now mainly of non-alcoholic cocktails. And so the idea is, not that one is never going to have a drink again, or that one is necessarily never going to be buzzed again. It's that one is going to be thoughtful about the decisions that one makes. And I think that's especially important in regard to something like alcohol that's so prevalent in our cultures, where so often the default or the cues surrounding us are saying drink, drink, drink. It can be really, really helpful to have a practice of asking oneself, what are my intentions today? Am I going to drink alcohol at all, or am I going to enjoy a non-alcoholic beverage? If I am going to drink alcohol, how much? How am I going to stick to that goal and make sure that I achieve it? I think we've seen a real rise in interest in mindful drinking over the last 5 years or so, um, which is, I think, is hopefully part of a broader project of people who meet the criteria for alcohol use disorder, who don't, who've struggled with alcohol, who haven't, all kind of reevaluating what's the ideal relationship with alcohol for me. There are a lot of right answers to that question, but it helps to ask the question to begin with.
Listen, I agree, and I think intentionality is key because I can definitely speak from anecdotal experience of falling into the trap of not being intentional, but just sort of relaxing into drinking on a night out, but then finding yourself three, four, five, six drinks in and then you're right, there's been not necessarily any mindful intention. It's just been just almost not habitual but social drinking, and actually, like you said, there's if you engage those cognitive skills of intentionality, hopefully it can you can moderate a lot more. Could I get you to speak to something which is really interesting, and indeed something I think a lot of us saw, this real uptick and exponential rise in alcohol consumption through the pandemic. And certainly there was a significant surge in drinking both nationally and internationally within UK and US. Could you maybe speak to some of the consequences you've observed and indeed how this period has influenced your understanding of alcohol use disorder?
Yeah, you're right that there are a lot of concerning data points out there. Not surprisingly, given that times of stress, economic hardship, social isolation are all things that can lead us to engage in behaviors like drinking that are not helpful in the long run. Here in the US, during the first 2 years of the pandemic, the number of death certificates that listed alcohol as a factor increased by almost 40%, the largest increase on record. Uh, but I think we're only at the tip of the iceberg, unfortunately, in that about 25% of people report drinking more during the pandemic. Not all of them are going to develop alcohol problems, but some of them will. Some of them will develop AUD. And given that it is a chronic condition, it often takes years, even decades, for the negative health, social, occupational consequences to develop. So I think we're going to be working through some of the consequences of the pandemic in terms of behavioral health generally and alcohol use disorder specifically for a long time to come. Now, I also like to look for silver linings because, kind of as a healthcare entrepreneur, it's a job requirement. And I do think there are two relative to the pandemic. One is we're getting a little bit of a spotlight shown back on alcohol use disorder. Within the realm of addiction, we've spent a lot of time focused on opioid use disorder over the last decade with good reason. It has been a crisis and a tragedy. Uh, but the reality is there are more people who struggle with alcohol than opioids, and they need attention and focus too. The second silver lining is over the course of the pandemic, we saw about, I don't know, 30 years of adoption of telehealth in about 3 years. And alcohol use disorder is a condition that's particularly amenable to treatment through those methods. So it's not all bad news.
Listen, let's go there actually, because you raise a fantastic point, Jonathan. That of exponential um, use and indeed compliance to digital innovation, indeed digital tools. So, if I could get you to speak to how digital health innovations are really transforming the treatment of addiction, particularly within AUD or alcohol use disorder, and indeed, if you could just also just give us some semblance of the promising technologies that are on the horizon.
Yeah, I see three really terrific trends happening right now. One is taking traditional treatment online. And so, just to use mutual peer support as an example, this used to mean finding a church basement you could get to, after work. These days, one can find an AA meeting, a moderation management meeting, a smart recovery meeting online, 24 hours a day, 7 days a week, that you can join wherever you are in the world. That is a huge step forward in terms of access in the moments that people need it. Number two is we're seeing the development of apps that are tailored to helping people drink less or quit. One that I'm particularly a fan of is called Sunnyside, and it's a mindful drinking app, not treatment for AUD, so appropriate for anyone who's trying to rethink their relationship with alcohol. And it involves tools like tracking, immediate feedback, the ability to get coaching via text, kind of putting in people's pockets tools that empower them to define and achieve a better relationship with alcohol. And then lastly, we're seeing the emergence of digitally native treatment options. And that's what we're doing at Our Health. We're one example of that. We are a platform where people can get access to medication assisted treatment. So connect with a doctor or nurse practitioner, get a treatment plan, get a prescription if appropriate, get the medication mailed directly to them if that's their preference. So long way to go on all of these fronts, but I think digital health is creating more options and more access to those options.
So let's go there actually, Jonathan, and look at the role of medication in treatment. My knowledge is quite minimal actually around medication or the efficacy and effectiveness of medication within alcoholism. But could you maybe shine a light on and elaborate the role of medication in treating alcohol use disorder, and indeed maybe even just denote what medications are commonly used and how they help the recovery process?
Sure. So there are multiple safe, effective medications for the treatment of alcohol problems in the US, the UK, and in most other countries around the world. In the US, there are three options that are indicated for treatment of alcohol problems. The most commonly prescribed medication is one called naltrexone. And the way that it works is it cools off the pleasure and reward pathways that alcohol activates. And so when we're not drinking, it can lead to fewer cravings. If we are drinking, it can make that first or second drink that you were describing less exciting, less euphoric, and therefore break down or at least cool off the feedback loop where one drink feels good, let's have another, two feels great, let's have many more. So it's appropriate for goals of both sobriety and moderation. Of course, medication is only one category of treatment options. We have professional behavioral health care, we have the mutual support groups we were discussing, we have the things people can do on their own, whether with an app or by themselves. And so one important thing to say about medication-assisted treatment is it is, in almost all cases, complementary to other treatment options rather than competitive.
Listen, I would wholly agree with that. And I think combination therapy is sometimes far more efficacious because it's multimodal and you can engage with cognitive tools as well as pharmacological tools. And it actually it's certainly within my experience and seeing a large patient group, combination therapy, even just within pharmacological combination of two or three different drugs can be efficacious. But could I get you to speak to combining medications with therapy? So these behavioral therapies in within treatment of alcohol use disorder, what benefits from your perspective, Jonathan, could you speak to around the integrated approach?
The evidence suggests that medication can be effective with or without therapy, but combining medication and therapy makes a lot of intuitive sense to me, as it sounds like it does to you. Most of us end up drinking too much for a combination of biological, behavioral, and social reasons. And so it just makes sense to me to adopt treatment options that address each of those contributing factors. Medication is, of course, going to work primarily on the biochemical component. So layering on therapy, if that's something that someone is open to, can do a lot of other helpful things. It can help us identify maladaptive patterns of behavior. What are those people, places, things that are leading to drinking too much? And what can we do to avoid them or act differently when we encounter them? If there are co-occurring mental health conditions, anxiety, depression, that are interrelated with the drinking, therapy can be very helpful in addressing those. If we have traumas in our past that contribute to our substance misuse, unpacking those and processing those with a mental health professional can be incredibly helpful. So I'm a big fan of combining therapy and medication. And maybe to say it even more broadly, I'm a big fan of each individual who is trying to recover or change their relationship with alcohol being empowered to combine the evidence-based treatment options that fit them, their goals, their preferences, their ideas about what will help, and that are good at activating the strengths, resources, and capabilities they bring to the change process.
Listen, I'm wholeheartedly in agreement with you actually. And like you said, there's a certain element of self-disclosure and accountability, I think, that goes along with this and transparency. So actually, having an accountable partner, albeit a healthcare professional that you check in with, to give you a sense, and I think that's a fundamental component of maybe Alcoholics Anonymous, having an accountable community that you are journeying with along the side the 12 steps, and I think that is a fundamental component of conscientiousness, and like you said, it's one of a number of tools which you can employ in a multimodal sense, which is fantastic. To pivot slightly, Jonathan, and just ask you maybe quite a personal question, actually, because this really probably adds depth and context to what we've been speaking about. If I could get you to speak to your personal challenges and breakthroughs, just maybe some of the biggest challenges you faced during your treatment journey, but also fundamentally your biggest breakthroughs. Where did you see the biggest breakthroughs in treatment?
Yeah, the biggest breakthrough was for me, and it won't be true for everybody, was introducing prescription medication, specifically naltrexone. It was that missing piece after I'd tried a lot of things in a lot of different settings. And that my biggest problem was I wasn't drinking every day, but there were instances where I could have one or two, but there were too many instances where somewhere around that third or fourth drink, I became a runaway train. And so medication really helped break that pattern. But even after starting medication, it wasn't like it was all smooth sailing. There were still challenges. Um, with the goal of moderation, one has to put in some work to defining what that means. Is it a number of drinks? Is it something else? For me, my bright line goal was avoiding blackouts because that is kind of what I associated with all the worst outcomes. And I think the most challenging moments in working towards that goal were in settings where all of the social cues were to drink, not mindfully, but maybe closer to mindlessly. Really crazy wedding or a outdoor birthday party that starts at 2 p.m. and is expected to continue till 2 a.m. And so I had work to do New Year's Eve. I had work to do to come up with the strategies, tips, tricks to succeed even in those challenging circumstances. Definitely do not have 100% success rate. I've had moments where I've fallen short of my goals. But over time, have figured out the strategies that work for me. No shots, no more than one drink before eating something, relying on my wife and other supportive friends to be an early warning system if they see me going faster than I should. So it is very much a journey. I really resonate with that word.
No, indeed, absolutely, absolutely, and putting these circuit breakers in, social circuit breakers with family, but also other circuit breakers, like you said, within medication and accountability is absolutely the way forward. Could I get you to speak to the stigma around addiction, Jonathan, and indeed because it can be a significant barrier, and society's perception of medication-assisted treatment, and indeed addiction fundamentally could be can be a, a disparate one which it contains quite a lot of stigma. Could I get you to speak to how this is and can be improved?
Sure. There are 400 million people around the world who meet the criteria for alcohol use disorder. So we can't just push them off to the side and say, this is your personal failing to figure out on your own. Um, Not least of which for, the reasons you cited at the beginning in terms of the burden on society and our healthcare system that the condition imposes over time. So we have to uh, treat this like a medical condition, offer people the evidence-based options, and kind of break out of what I think of as old dogmas, that there's only one way to recover, that abstinence is the only legitimate goal of treatment, that medication has no role in recovery or is simply replacing one drug with another. I don't think that's a particularly trenchant criticism of the medications that are used to treat alcohol use disorder, which are not themselves addictive or subject to abuse. What we need is an approach that's much more consistent with how we treat other chronic conditions. So if someone shows up at their GP's office with cholesterol or blood pressure levels that are way too high, putting them at risk for all sorts of negative health outcomes, what are we going to do? We're going to negotiate a goal. Getting to target would be the best goal, but any step in the right direction is a good one. And we're going to offer a menu of evidence-based treatment options that are likely to include medication and behavioral interventions, as well as changes in lifestyle. That's exactly what we need to do when it comes to breaking down the stigmas around alcohol use disorder. We have a lot more effective treatment options than we did 50 or 100 years ago, where there wasn't a lot for modern medicine to offer the quote alcoholic. We've learned a lot since then. We need to implement what we've learned.
That's fantastic, actually, Jonathan. And maybe for someone on the fringe of considering treatments, could you maybe speak to the advice you give to someone who's considering medication-assisted treatment or indeed moderation as a recovery goal, but is sort of unsure about the first step? What would you advocate to them for sort of the first steps in moving towards treatment?
Yeah, it's a first that, change is possible. I'm one example of that. There are millions of others out there. Two, the options to achieve that change are more numerous and varied than you may expect. Um, some people achieve the change on their own. Even within the realm of treatment or support, there are multiple options that we've talked about. So it pays to do some research, to familiarize yourself. You don't have to become an encyclopedia of every option under the sun, but if the ones you're most familiar with don't feel like a good fit on the dimension of goals, methods, values, there's likely a better fit out there. When it comes to medication assisted treatment specifically, a great place to start is oarhealth.com, oarhealth.com. We have a lot of resources that go deep on AUD, MAT. We don't take those acronyms to be household names. And then the last piece of advice I'd offer is, it's never too early or too late to get started on a change project. You don't have to wait to hit rock bottom, which is another one of those outdated dogmas. Um, but on the other side of that coin, even if things are feeling really dark and difficult right now, improvement is always possible.
Listen, I'll include the your Oral Health in the show notes, just the links there, because there is some fantastic pieces of information there, just on the pathology itself, but also, like say, the modalities of treatment. Could I just get you to speak to the future of addiction treatments, Jonathan? Could just looking ahead, what are your hopes for addiction treatments, and in particular the alcohol use disorder in that context, but also if as innovation continues and attitudes change, how do we improve outcome?
First and foremost, I hope that we connect more people with the existing evidence-based treatment options that exist. To take medication as one example, about 2% of people with AUD are prescribed a medication to help them drink less or quit. That's way too low. Secondly, we need more treatment options. We've got some good ones on the menu, but relative to medication again, we could use more. We have, 3 or 4 medications is good. It's way less than we have to address depression, for example. And then we don't just need more options. I think we have room to go in terms of getting better about identifying and recommending what sort of options and pathways will best fit each patient. Sometimes I hear that we're entering a phase of precision medication writ large or precision medicine, and that does not ring true relative to the treatment of AUD. We've got a ways to go to achieve that. But there are exciting developments, even, the potential of GLP-1s to reduce overconsumption of alcohol is pretty exciting. A lot more research to do to prove that out, but it's exciting. And then lastly, I think we can continue to empower the people who are doing the recovering. They are the most important people in this process. And so starting from a societal and cultural level, moving down to the way people are met in healthcare settings when they express a concern about their alcohol use or it emerges, we need to be sending the message that recovery is possible and that the individual who is trying to change their relationship with alcohol has a vital role to play and should be given a loud voice in what treatment options go into their recovery toolkit. Because one way or another, they're going to be doing somewhere between 50 and 99% of the work.
No, listen, that's fantastic. And like I said, we'll put the links to Oral Health in the show notes. I think, like you said, there's a certain level of personal accountability with others, accountability and compliance tools actually as well. Because, like you said, some people do really well with tracking metrics of how much they drink and indeed whether there's incremental gains or losses, so that there can be a semblance of visibility over time, but also, like you say, access to different medications, different behavioral therapies as a drop-down menu, because you said this earlier, and I really think it's so true. What is for one person doesn't always work for another person. No one is beyond the pale. So no one is beyond help, because I and probably you have seen some fantastic recovery journeys, both as a clinician, but also just your own recovery journey. Your own testimony, Jonathan, is powerful and shows that actually there is different modalities that do work. So that's absolutely fantastic. We'll put all that in the show notes. So thank you for your time, Jonathan, and thank you for your transparency this past hour.
Well, thank you for having me, Owen, and for using this platform in a way that can help so many people.
You're listening to the Pre-Hospital Care podcast on the Medics Academy Network.